Understand.
Irritable bowel syndrome, or IBS, is a chronic disorder that affects the large intestine or the colon. Sometimes we call it spastic colon, but it's another term of irritable bowel syndrome, but spastic describes the spasms of muscles in the small and large intestines. This term is not right because spastic colon isn't always accurate, because IBS may also be associated with decreased motility or movement of the intestine. The symptoms of irritable bowel syndrome vary from person to person. The most common symptoms are abdominal pain or cramping, feeling bloated, having gas, diarrhea or constipation, sometimes in alternating bouts, mucus in the stools, and for most people, IBS is a chronic condition. The symptoms might get better or worse, or even disappear completely over time. But there are symptoms that may indicate a more serious condition, and that's why you have to visit a doctor as soon as they appear. These are rectal bleeding, abdominal pain that progresses and occurs at night especially, weight loss, diarrhea and constipation that can aggravate the hemorrhoids. Also, when you avoid certain foods, you may not get enough of the nutrients your body needs, and then we have a case of malnutrition. So IBS may negatively affect the quality of your life, leading to discouragement and depression, and that's why you have to find a solution for it. Because there are no physical signs that the doctor can find to definitely diagnose IBS, your doctor will diagnose it by ruling out other conditions. So be ready for a lengthy process for diagnostic tests, and sometimes it will need a hospital admission. For example, you might need imaging tests, lab tests, and maybe endoscopy operations. Because it's not clear what causes irritable bowel syndrome, treatment focuses on the relief of the symptoms so that you can live as normally as possible. In most cases, you can successfully control the mild problems of irritable bowel syndrome by learning to manage stress and making changes in your diet and lifestyle. If your problems are moderate or severe, you may need more than lifestyle changes, and in this case, your doctor may suggest medications. So we have dietary changes, like eliminating high gas foods, items as carbonated beverages, and certain vegetables, especially cabbages, broccoli, and cauliflower, and also raw fruits. This should be avoided in case it gives you gas. Eliminating gluten can be helpful because research shows that some people with IBS report improvement in diarrhea symptoms if they stop eating gluten, so wheat, barley, and rye. There's also eliminating the so-called FODMAPs. Some people are sensitive to types of carbohydrates found in certain grains, vegetables, fruits, and dairy products. You may be able to get relief from your IBS symptoms on a strict low FODMAP diet, and then reintroduce foods one at a time. Talk to your dietitian about starting a diet program low on FODMAPs. Your doctor may prescribe medications like fiber supplements, antidiarrheal medications, anticholinergic and antispasmodic medications, antidepressants or antibiotics, but all these medications should be used for short-term relief of symptoms. In many cases, simple changes in your diet and lifestyle can provide relief from irritable bowel syndrome. Although your body may not respond immediately, your goal is to find a long-term, not temporary, solution for your IBS. So here are some suggestions. Chew very well on your food. Take the time to chew your food into smaller and smaller pieces until it's essentially a liquid before swallowing. The interaction that your saliva has with your food is very important for the digestion process. Experiment with fibers. Although it helps reduce constipation, it can also make gas and cramping worse. So the best approach is to slowly increase the amount of fiber in your diet over a period of weeks. Foods that contain fiber are whole grains, fruits, vegetables, and beans. Avoid problem foods. Keep a food diary, find out what upsets your colon, and eliminate it from your diet. If certain foods make your signs and symptoms worse, don't eat them for a while. These may include alcohol, chocolate, caffeinated beverages such as coffee and sodas, also medications that contain caffeine, dairy products, red meat, and sugar-free sweeteners such as sorbitol or mannitol can also be troublemakers. If gas is a problem for you, foods that might make your symptoms worse include beans, cabbage, cauliflower, and broccoli. Fatty foods also may be a problem for some people. Chewing gum or drinking through a straw can also lead to swallowing air, causing more gas, so avoid that if that causes a problem. Take care with consuming dairy products. If you're lactose intolerant especially, try substituting milk for yogurt or use an enzyme product to help break down lactose. Consuming small amounts of milk products or combining them with other foods also may help. In some cases, though, you may need to stop eating dairy foods completely. In this case, make sure to get enough proteins and calcium, also vitamin B, from other sources. Herbs, especially peppermint, like fresh peppermint and peppermint tea, may provide short-term relief of IBS symptoms, so give it a try. Probiotics are good bacteria that normally live in your intestines and are found in certain foods like yogurt and in dietary supplements. So if you have IBS, you may not have enough good bacteria. Adding probiotics to your diet may help ease your symptoms and make you feel better. Drink plenty of fluids every day. So water is the best, and avoid alcohol and beverages that contain caffeine because this will cause diarrhea to become worse. Also, carbonated drinks can produce gas. So water and herbal tea are your best options. Eat at regular times. Don't skip meals. If you have diarrhea, eating small, frequent meals make you feel better. But if you're constipated, eating larger amounts of high-fiber foods may help move food through your intestines. Exercise regularly. Exercise helps you relieve depression and stress and stimulates normal contractions of your intestines. This can also help you feel better about yourself, and this is very important. Use antidiarrheal medications and laxatives with caution. In the long run, these medications can cause problems if you don't use them correctly. So always check with your doctor or pharmacist before using any medications. And read the patient information leaflet carefully. You will find it packed with your medication. Always remember that a healthy lifestyle is the key factor to overcome IBS. So go for it, and all the best. This video contains general information about medical conditions. The content might not be suitable for everyone and should not be treated as such. Always consult your doctor before using medications. The medical information is provided without any warranties or legal obligations to those who might apply them.